So let me just start. Well, good afternoon, everyone. As most of you know, I am Hiral Shukla. I'm an outreach coordinator at Crossroads for Hope. We were formerly known as Cancer Support Community Central New Jersey. Only our name has changed, our mission hasn't changed. So for those that don't know what Crossroads for Hope is, we're a nonprofit that provides psychosocial support as well as health and wellness and educational workshops to anyone that is impacted by cancer. So not just limited to someone that is diagnosed, but also caregivers, families, and children. So on behalf of our organization and Robert Wood Johnson University Hospital, Somerset, we're happy to welcome you to Mental Health and COVID-19, how we've been impacted. During today's presentation, we'll be discussing about how mental health issues are becoming more prevalent with the COVID-19 resurgence and affecting everyone, not just those with mental health history. Our presenter today is Dr. Huma Ansari, who is a psychiatrist at RWJ Somerset. Be sure to mute yourselves and feel free to drop any questions or comments in the chat that we can address at the end of the presentation. And I thank you for joining. So before Dr. Ansari actually starts to speak, I'm gonna launch a poll just to kind of see where everybody's mind is when it comes to mental health, just a few basic questions. So I'm gonna launch it right now, and if you can answer on your end, that'll be great. We have a lot of people, so just bear with me as I see the numbers go up. I'll end the poll before Dr. Ansari starts to present. I'm going to end the poll. Oh, some people are still answering, so I'm going to give it another like 10 seconds. We'll launch the poll again towards the end. This was just to get an idea of what people know about depression. Okay, I'm going to share the results so Dr. Ansari, you can see what people have answered. So majority for the first one said false, majority for the second also said false, and 3 also false. So I'm going to stop sharing and I will hand it over to you.
Okay, cool. Let me close this chat box for now. Hello, everyone. I hope everyone is safe, sound, healthy, warm in this weather, of course. And I think the poll indicates by now, after going through the pandemic for almost a year, we are all experts in mental health, having dealt with or ourselves or having dealt with someone who has been going through it in our near and dear one circle. So how are we impacted in terms of mental health with this pandemic? Well, as you all know, the root cause is stress. And we have been extremely stressed for such a long duration of time at this point. I don't think we have had any state in most of our lifetimes that has lasted this long, that has been so stressful at the same time. So where is all this stress coming from? Number one, we are isolating. We're not going out and meeting people. We're not doing our usual normal things that we used to do, right? Hanging out with friends, going for drinks, maybe, catching a dinner, having parties. None of this really has happened for majority of us for now a year, right? We are talking through Zoom, right? This event would probably be happening in person at some point. but now we have resolved to Zoom meetings, so at least we can get through the information, get the support out, have everyone at least get some FaceTime and not just over a phone, which is great, but it's not the same as sitting in person with somebody, right? So that's stressful. The other part of the stress is those who have families, kids, right? Everyone is home. We're having our kids joining their school from home. And those of us who are working from home have to make time to make sure that we see after kids what they're doing, if they're actually attending the class, if they need any help. So that's an additional burden, right? Even though we would like to help our kids, we would love to help our kids and we would do it willingly. Nonetheless, it's a burden, right? It is an added stress. Being around each other 24/7, right, creates conflict. Other times we would have time, we're going to work, we're hanging out with friends, we get a breather. We get time away from our family, right? If we have any issues at work, we get time away when we come back home, and that's our breathing space, that's our de-stressing space. But now all the space is just one and intermingled, and there's no separate corners that we could go to. Maybe we may have made some corners in our house. This is my safe space, or this is my relaxation space. But that's all within those four walls, right? And there is no breathing space, no me time. I don't have a time to take a break and just focus on myself, because I have to focus on everything that's going on in the house. And that's stressful, right? Add to that, if we are dealing with any type of illness, physical or mental illness, right? That adds to it. Everyone who has gone through this pandemic has had some sort of health issues that they have dealt with at one point or the other in this year. And if we already have a chronic illness going on, whether it's dealing with, recovering or dealing with any type of cancer or any other chronic illness, be it, what we would call it our usual health issues, diabetes, blood pressure, even that, we have had difficulties getting our medications on time, getting blood work done because we have to go out, and where are we going to go out? What labs are open, right? What doctors' offices are open? In the beginning, everything was shut down. Nothing was open, right? Finding treatment, finding our usual daily health coverage or health treatment was difficult. So all that adds to it, and that when that worsens our health issues, then that's another, ding to the stress scale, right? So all that has been, many people handle their stress. My mind is going too much. There's too much, and I need to get everything out. Some people go to therapists, other likes to go to gyms, right? Exercise. I'm gonna take a run. I'm gonna go take a nature walk. I'm gonna hit the machine. I'm gonna hit the treadmill, and then gyms were closed. They're finally starting to open up some now, but that it's still not been the case. What we did at home, doing nothing, eating, right? Stress eating, if you want to call it. And then we are worried about what if you're gaining weight, and how we're going to lose weight because we are not exercising. We don't have time to exercise. We don't have space to exercise. Total mess, right? And as everyone said, we are getting impacted. Everyone, not just anyone who had family history or history of mental health issues, right? So mental health, just like any health issues, don't discriminate as to who gets it and who doesn't, right? No age, no gender, no ethnic, racial group, nothing. Everyone is in the same at the same time. So I put that question that being strong-willed can get us through depression, anxiety, and all that. Now, this is, since it started out as a cancer outreach community, I'm going to give the example of cancer here, right? I found out today I had an appointment and I got officially diagnosed with cancer, right? I'm going to feel significantly down and depressed, if I can call that, and I'm going to have a hard time handling. I may not want to talk to anyone. In the initial few days, and that can be different for every person, right? It could last from days to weeks. If I can stay strong, if I have support from family, then that would work. Yes, right? I have to not let it get to me. I need to work out, you know, do things that help me calm and relax, and keep my will strong. And yes, that will help. But there comes a point where will alone does not work, right? Um, I am getting to a point where I don't want to get out of my bed now anymore because I got a bad news, whether it's cancer, whether it's I lost someone nearby to this pandemic, or because this pandemic is getting to me and I'm not going out, I don't get to talk to people, and all that is getting to me, and I'm getting sad and depressed. Now I just want to stay in bed and do nothing. What's the point? It's going on forever, right? I start thinking completely negative. It hasn't gotten better. The vaccine is coming, but the virus is mutating. So what's the point? Why do I keep going? I don't even get to go out and do anything. And there doesn't seem to be any point, any time frame that it's going to improve. So why do I keep going? Why do I talk to people? There's no point. I don't get to meet them anyway, right? And then it comes a point where I start to get, what's the point in living anymore? This is not life. Why do I keep going? Maybe I should just, stop eating, stop taking my medications, stop caring for my health. Maybe I'll just go. Maybe, God, I go to bed tonight. Don't wake me up tomorrow morning, right? And then it can get to a point if I'm still just not getting any help. At this is the time when I stop talking to people, when I stop getting out of my bed, when I stop caring about my eating, my sleeping. This is the time I need some help. I cannot do it just by my will, just by myself. I cannot do it. And if I'm not getting that help, it's going to get to a point where instead of just praying that God don't wake me up in the morning, I'm going to start to get ideas, and I'm going to start thinking about what can I do to just end this. This is too much. I don't want to live like this. I cannot continue living like this. I have to put an end. And I'm going to start finding ways. I'm going to start Googling, how can I kill myself, right? So this, in the beginning, when we're getting down and we're getting overwhelmed, we're getting stressed, our will and how strong it is and how weak it is does matter. And it can impact how fast or how slow our further progression might be if we don't get help in the meantime. But there comes a point where we cannot do it just by ourselves, and we need somebody, ideally some professional help. And by professional, I mean, we can be talking to, psychiatrists, we can be talking to therapists, but that also includes some of our religious leaders, right? Pastors, or any religious community member for that matter, if for those of us for whom religion is important, right? It could be a close knit of friends that we talk to that are our support. It could be a close knit family member, right? So we need to start looking for help when we are losing hope, when we start noticing ourselves. If we can just sort of keep an eye on ourselves, right? Because right now most of us are isolated. If we can just reevaluate for a minute, okay, where am I? What am I going through? Am I in this space where I'm becoming what we like to call hopeless? Nothing is going to change. Nothing has changed, and we just need to let it go. If I keep sort of evaluate myself outside of myself and I notice this is somewhere I'm going, I want to seek help. I want to talk to my husband, my mother, my sister, my daughter, whoever might be the case, to begin with, to start the discussion, to start the talk, and then, escalate it as the need goes, and get the professional help if nobody is available, or just talking to my family and close ones is not getting me out of this funk, some people would call it, right? A hole, a darkness, whatever it might be. For some people, it's not depression. For some people, it is anxiety, right? I just can't rest, it's just constant fear and nervousness. What's going to happen? Am I going to die? Am I going to get the pandemic? Is my family going to get it? When is this going to end? Is it going to end? If these are the constant thoughts that keep in my mind, maybe affecting my sleep, if I eat, I started throwing up, that restlessness, that constant nervousness, that anxiety can be a struggle for some people. And I work here in the ER, so I see a lot of people coming primarily to the emergency rooms. And anxiety, it starts with anxiety primarily because of the pandemic, and it leads into depression, right? So this is kind of a trajectory of mental health that most people are getting. First, it's anxiety though. Hits if people who have gotten pandemic and have needed some sort of treatment, whether it's outpatient or they needed to be admitted, for them, for family members, near and dear ones, first thing is the fear and the panic and the anxiety and what's going to happen. And if it continues to last, then of course depression sets in. So that, I guess, in summary, in short, that's how our mental health has been impacted, the basic reasons for it. Some of the common things, I say common, but I guess it could be different for everyone, but some of the things we can do, even being isolated. Number one, stay in touch with people who matter to you, right? Family, friends, community, whatever it be, support groups, stay in touch. We call it social distancing. Many of us in our field, we hate this word, and I'm putting the word hate because it's not, social distancing is not what we need. Physical distancing, we like to call it. Even though we are physically distant, we need to keep social contact, and social distancing is not good. That's just social isolation, and that's the root cause of all the mental health issues. So even though we are physically distant, we need to keep the social connection going, right? Whether it's by phone, whether it's by these video platforms that are available to us these days, multiple of them. Meditation helps a lot for a lot of people now. Meditation can be whether you do, hardcore meditation, like your therapist might tell you, whether it's yoga. But for some people, meditation means reading their religious scriptures, right? That is meditation. Praying is meditation, if that's what you believe in. If you don't believe in, of course, that's not something that's going to work. But what I'm trying to say is meditation is not just sitting and closing your eyes and thinking and keeping yourself calm. That is not the only form of meditation that exists. It can be anything. It means giving space to yourself, trying to break your thoughts and trying to keep your mind space inside and not let it wander in every direction, and just give yourself that few moments of quiet just to yourself. Okay. For some people, taking a walk in the park can be meditating, right? Or going out, sitting in a park. Of course, not right now. We don't want to freeze in the weather, but when the weather becomes a little nicer, which hopefully is around the corner, right? Going out in the park, just sitting, listening to this sound of wind rustling through the leaves of trees, that can be meditating, right? So there are different forms of relaxations, meditation that can work. What else? Okay, the last thing I said, finding treatment on that. How do we find treatment? So I want to show you a couple things which you can do from the comfort of your home. I have two websites I want to share with you. So I'm going to share my screen here. And where am I? This is one. Share. Okay. So this is the county website. Okay. county.somerset.co.somerset.nj.us. So if you look at Somerset County website and you look for mental health services, you will find this page, right? It outlines Richard Hall Outpatient Department. Okay, this has different types of services. Richard Hall is our community mental health center. County mental health center for Somerset County, right? There are different mental health centers for every county. If you are from a different county, you can look up county mental health center, Middlesex County Mental Health Center, and that can bring up the clinic or the facility that's in your county. And this is another, I guess, what I use most often to find any treatment, any providers. This is psychologytoday.com. Okay, this is a website that is very up to date, I find. Okay, you can look for psychiatrists, you can look for treatment centers, you can look for any teleservices, or if you're looking just for therapists, you can put your zip code. I'm going to put here Somerville, right? And you search, it's going to bring up therapists that are around Somerville. And if I open, I'm going to open just this first one, just to show you what it is. So it will list you, of course, 99% of the time there's a picture, so you can identify who you might be talking to, their phone numbers, and they tell you whether or not they are giving any telehealth services, right? Whether they're giving therapy sessions or psychiatrist appointments via telehealth. Okay, they list what issues they specialize in, majority of them. They will enlist here, I'm going to open another one just to show you. They will enlist somewhere here what insurances they're taking, okay, if any, what age groups they focus on, right, and what other issues they are able to give you services in general. Let's see, I'm going to see if there's anybody with insurance information in there. Nope, not this one. Just so you guys have any idea where to look for that. Okay, so right here, it talks about if you're giving, they do provide sliding scale. This is their cost, but these are the insurances a person is accepting. You can see if your insurance is on that list or not, or if their session per cost is something you might be willing to pay out of pocket, if that be the case, right? How many years ago they graduated, how many years they have been in service, and like this one they have adolescents. So if we have kids who we are finding that they might need some help, we can look for someone who is taking that age group, right? So for us and for our family members, we can look that up. Very easy to find online services, especially, and many right now with the pandemic and rules being relaxed, many of them are offering telehealth services. So that makes it a lot more easier, right? But again, you can always look for your county's mental health clinic. And like in this one in Somerset County, we have the screening center, Bridgeway PES, and they are a 24/7 service as well, right? You can call that number, the screening center of your county. They are available 24/7. You can always call the New Jersey Hope Line, which I should have had it here, but I'm going to find it now. I should have looked that up because that is something you can call anytime. Okay, so that's the New Jersey Hope Line. Okay, have this number again, 24/7 you can reach out. If you have any adolescents, there is, this is a dedicated hope line and helpline for youth. Okay, that's the number. This is available for text, for call, and they have a chat line as well. You can just, where is that? Message board. You can go there and you can chat with them, or you can call and text. Adolescents these days likes to text, so they can just text what's going on and get a text back instead of if they don't want to talk. Many adolescents do like that better than actually speaking to somebody. So these are various services that are available, and if you're looking for any routine help, any of these 24/7 lines, like Hopeline can provide you services in your county. They can look up if you just want to call somebody, call a Hopeline and have them help you find services in your neighborhood, in your area that might be available and that might be able to get your insurance. They can look that up and hopefully get you that help. Okay, I think I am going to stop here. And then we'll see if anybody has any questions that we can target particularly. Thank you very much for listening, and feel free to send your questions if any. I'm going to leave this screen sharing for a few more minutes, and then we can get it off and then bring it back if anyone specifically needs it.
Thanks, Dr. Ansari. So I can actually just write down all the three websites that you sent or actually showed and send it to the group as a possible resource, of course. And then Rob Wood Johnson University Hospital, Somerset, of course, is also a resource as well. So if you have any specific questions regarding mental health and any other concerns, you can definitely unmute yourself and speak if you prefer that, or if you want to send me personal message and I can ask the question, or you can drop it in the chat. Do you know what medications are available for major depression?
There are a lot of medications. Mostly what medications are used is one class of medications, broadly called SSRIs. Basically, they target the neurotransmitter serotonin in our brain that is majorly involved in depression. So the group of SSRIs, and you may have heard some of these names, some of them are very old, some of them have been added lately. Zoloft, Paxil, Prozac, Celexa, then Lexapro. There are some Wellbutrin, Effexor, Abilify. There are a number of medications. Typically, how we choose medication is, let's see what other medications you might be taking. If you have any health issues that may be a possible side effect from, sorry about that, that may be a possible side effect from a particular medication that we could rule out. Or, you know, if there are any symptoms you're having, again, if there are side effects from medication, or if you have, or a close family member has taken a medication and either didn't respond to it or had any major side effect from it, then we try to see which one might be a right fit for you, although there's no way of knowing unless a person actually gives it a try. So it still is, you know, initially it's a trial and error. Some people like to say, you know, yeah, we're being guinea pigs. Unfortunately, we don't have a blood test to do that. Okay, you know, like we can say, we can get blood cultures and sensitivity and know this specific antibiotic is going to work for this bacteria that you have, and this person is, you know, can reasonably respond to it. In psychiatry, in mental health, we don't have any such test to determine what medication might work for somebody. So in the beginning, yes, it's a trial and error, but we try to see all the different aspects of health issues and any medications you might be on, and come up with the best educated guess, give it a try, and then take it from there.
Great.
I hope that helped.
There wasn't any question, but I particularly just had a specific questions. What sort of symptoms should one look for, especially someone that isn't dealing, who have never had depression, who's living a perfectly normal life? What are some of the pandemic blues? You know, I feel like I've felt it this week, just sort of realizing, okay, I'm getting lazy to even just get up and do my hair or whatever the case may be.
Right.
But what sort of symptoms can they look for and catch themselves?
Of course. So as you rightly said, you know, pandemic blues, you know, we are all getting it. We are staying in home. There's no reason to go out. So no reason to, you know, get dressed up or put our hair, you know, get our hair done, nails done, and all sorts of things. So that definitely is there. But to say who is getting sort of clinical depression, right? If it's interfering with my day-to-day activity, then, you know, to be very simplistic, that is something that I want to have a discussion with a professional to see where I stand, right? Things to look for, again, is if I am having, my appetite is changing. Either I am, for no particular reason, I'm either eating too much or I'm not eating as much as I should be, right? If my sleep is impacted, again, it could be I'm sleeping through the day and I'm sleeping through the night, I'm sleeping 18 hours a day, and I can't seem to get enough rest and I can't seem to get my eyes open, or I am not sleeping, I'm waking up, especially if I wake up like very early in the morning and then can't go back to sleep. That is one of the hallmarks of sleep disturbances in major depression. If I am not enjoying things that I used to enjoy, right? I love reading books, or I did until 2 months ago, and now I can't find any joy in reading the books. Or I loved listening to this particular type of music, or music for that matter, and now I might turn the music on, it doesn't do anything for me, right? So things that I used to enjoy, I no longer enjoy. That's an issue. If I'm becoming hopeless and everything around me is just miserable, right? Yes, I'm not getting out of bed. I'm so tired all the time that I can't get out of bed. I don't want to answer my phone. I don't want to answer my door. I see my best friend calling me, but I'm like, no, I'll call them back. I really don't want to talk right now, right? If I find myself doing that more often than not, it's a sign. It's one of the things to look for. And then, of course, if I started thinking about, what's the point in living? If I'm having any of the thoughts about giving up on my life in any spectrum, then that's something to watch out for as well.
Yeah, we had someone that just stated that no longer finding joy in things we used to enjoy is something I relate to. I definitely can relate to that. I think I've been feeling more so maybe because of the winter time, because I'm unable to go out and walk after work. That was my time, so.
And I'm glad you mentioned that my time, because that's important. Even though we may not be getting to do the things we used to do, the things that get our time, we need to find some way that me time, right? We have to figure out somehow or the other to get that time for ourselves, whether it's by meditation, whether it's by excluding ourselves, whether it's going to, everyone is on the main floor, I go to the second floor for like 10 minutes, right? I take a long shower because that's going to be my time. I'm going to take 10 minutes extra, right? 5 minutes extra, but we need to find that me time somehow to kind of reset, to kind of focus back, to kind of reflect, whatever be the case for your particular day or your particular week. We need to do that. And that, because that's very important. When we lose that, then we just kind of get scattered brain and we are in 10 different directions and we can't grasp onto ourselves.
Absolutely. And I think as women that are working from home, there could be a lot more distractions at home, whether you have kids that are going through virtual learning. So you're not only just working and you have your own obligations, right? But I think even just having a load of laundry sitting in front of you is distracting and you want to go tackle that. So I think it becomes very mundane. And I think that's where the problem comes in, is to be able to recognize those pandemic blues and check yourself before it gets to that point. There was another question. What advice do you have for a caregiver of someone with depression but doesn't want to get help?
Very good question again. It's difficult, and it can be very challenging and frustrating at the same time, because I am seeing my family member, my loved one, needing help, but they either don't see it or they continue to push us away, even though getting that support is going to be what they need from at the very beginning anyway. What I would say is, when somebody is refusing help, what I can do is not give up, but not push too much, right? Let them know I'm here for you, right? Keep checking in, even if it means a little bit more frequently. And maybe give it a week where I don't bring up the topic, okay, maybe you should get help, right? It's been happening for 2-3 weeks, and I keep telling my mom, you need help, or my sister, but they don't listen, and they kind of pushed me away. So for the next week, I'm going to call, and I'm just going to check on them, how you're doing, just chit chat about the snowfall and the kids and, the work, whatever might be, or the, some fun times from childhood, whatever be the case. I'm just going to talk and be there for them. I'm going to call every single day, and I'm not going to bring up any treatment or anything, right? Just for one, letting them know I'm still here for you, right? And then a week later, if I'm going to bring it up again, they might be more willing to listen to me. They might be more perceptive about it. They might think, okay, now this person, she has been my family, this has been talking to me for a week, and still thinks I should get help, even though they didn't bring it up, right? It might be more receptive to bring it back after some time. But in the meantime, just keep at it, stay in touch, let them know I'm there for you. And if you need to talk, call me anytime, even don't wait for me to call, right? That might work out. Again, we have to give it a trial and error, but don't give up. Don't just, okay, you're not listening to me, I'm not going to call you anymore, right? That's going to be not just not helpful, but that can be detrimental. You need to build up their trust. You need to build up that rapport again, and then bring the subject up again.
Yeah.
But it is challenging.
Absolutely. We had another comment. This says, gratitude is a mechanism to employ. We all have something to be thankful for at any given time. More so now, more than ever, I feel like, to be finding your reason, right? And finding that gratitude.
Right. And that's absolutely true. I do want to add, when somebody is at the point where they're getting what we call clinical depression, they lose their reasons to live, right? So finding a reason to be grateful is kind of like at the bucket, at the bottom, right? If I can't find a reason to live, I don't have a reason to be grateful about, because if I had a reason to be grateful about, I wouldn't be thinking about giving up on life, right? So it can be challenging. So just to, I guess, be mindful and keep an eye when we're talking to somebody around us. I might be at a point where I can find something to be grateful about, but if a person in front of me is not finding that, I want to be careful not to say something that might, I guess, like demeaning them in any way, right? Or saying like, how come you don't have anything to be grateful for about? Everyone has something to be grateful for about. We can say that in a gentler tone. I guess what I'm saying, we need to watch our words and watch how those words are being conveyed to someone who might be at a point where they are absolutely in a position where they're not finding anything to be worthy, worth living for. But yes, if we can find one reason to be thankful for, absolutely, that can, one positive in our lives can bring up another positive. And I tell all my patients, as I'm talking about positive, I'm just gonna, blabber about that one as well. When we start having any negative thoughts and feelings, right? It's like a magnet. One negative thought is going to pull in 10 negative thoughts. And before we know it, we are going to be surrounded by negativity. To get a positive thought into ourselves, to have it stick to us, we need to work actively. We need to find and stick and put a strong hold onto any positive thought to offset all those negative thoughts. So negative thoughts come very easily. Keeping and holding on to any positive is a lot of work. If you find something positive, hold on to it. Remind yourself over and over again about that. Maybe write it, keep some post-its around you. If you're finding yourself, what's going on and what's the point, when you find that point, write it in your journal, write it on a piece of post-it and put it on your fridge, by your, on the table where you're working, or by your, side table, somewhere where you are constantly going back. Maybe put it on your mirror in the bathroom, so that when you go wash your hands, you look at it and you're reminded of something positive. because it is a lot of work to keep on holding on to any positives.
I have a question that says, can weather have effect on your mood as well?
Absolutely, absolutely. And the term winter blues is coming from that. You know, a lot of us, when there is not sunlight outside, it's dark, it feels gloomy. And so absolutely, weather definitely has effect. People who have mood swings, you know, some sort of bipolarity or even depression takes a dip for people who deal with that year on year. When the winter comes, it kind of takes a dip, right? The days are smaller, the nights are longer, it gets dark quickly, it's snowy, difficult to walk outside. Again, all those things that keep us more isolated, right? That's what winter months do, right? We are not going out as much because it's either cold or slippery or snowy. And just lack of sunlight, yes. That's why, you know, we feel so good in springtime because it's bright and sunny. So, you know, if you are in home on a dark day, turn on all your lights, right? It does make some impact for those who have seasonal changes in their mood, absolutely.
Okay. And then another question is, how does a patient understand whether their medication is working well enough for them? Are they not supposed to have any emotion and be numb? Or is it still healthy to have some negative thoughts or moments, days where you feel down?
Right. You don't want to get to a point where you're emotionally numb. That's not a good space to be in either, because then we start to find ways, okay, I need to feel something and I need to do something to be able to have any feeling. So no, the treatment and feeling better doesn't mean lack of emotions, but to be able to sort of somehow or somewhat in control of our emotions. You know, I have some bad news. I lost a job, or, you know, I'm being laid off, or I lost a family member, and I get sad. I may cry, and that's okay, right? I may be sad for a few days in a row, right? That's normal. That's expected. If I'm not having an emotional response, that is not normal, right? We expect if we get a bad news to be sad about it. We expect to be jumping with joy if we get a good news, right? If we may not be the level to which we get the emotional response may be different for you know, among all of us, right? But if we have no emotional response, that's not a good place to be in, right? So whether the treatment is working is whether my emotions, that like I said, it doesn't mean lack of complete emotions.
Okay. We have another comment that says, I suffer from seasonal depression and I was advised to purchase a therapy light. It makes a big difference. Have you, I've never heard of it.
Yes, absolutely. Absolutely. If you have been diagnosed, there is such thing called seasonal affective disorder or seasonal mood disorder. And if you are suffering from that, having that therapy light, you are the doctors or, you know, the different manufacturers of these lights have specific patterns. You have at this lux of light and you sit in front of this light for this many minutes, once a day or twice a day. But yes, that is a treatment, that is a therapeutic management, and it does work, especially for people who suffer from seasonal affective disorder. So if you are told it's not a hoax, it's true, please go ahead and get it.
Sure. And then the next comment was, perhaps the work of staying out of depression begins when you're feeling not yet depressed. For instance, trying to control, replace negative thinking on a day-to-day basis, not dwelling on the past, keeping busy could be some of the techniques, which I agree.
Absolutely. We need to work on every single day to make sure we are feeling good, right? Or we are feeling okay. And if we have a sad day, let us have that too, because like I said, we need to experience all the emotions. But absolutely, we need to start the work beforehand, because if we don't, that's why I talk about keeping an eye on ourselves, right? If we let it slip, it could very easily go, you know, from being okay, from being good, from being okay to deep in depression if we don't pay attention to how our emotions are going or how we are feeling. So I absolutely agree. Whoever said it, absolutely right. We need to work every day before we get to a point where we are depressed.
I know it's really, cold to walk outside, and for those that really enjoyed it. And I know one thing that helped me after myself feeling the pandemic blues was just, let's just take a day out of the weekend and go to the mall and just walk around the mall. And honestly, it was refreshing. I came home feeling, okay, I needed that, just getting out of the house, and, whether it was grabbing dinner to go home, just being out and just walking around and not having to, you don't have to go into the stores, you don't have to touch anything, double mask. And again, if you're feeling those pandemic blues, finding those little things are really helpful. Another thing I told myself is that I'm not going to get distracted by the dishes in my sink or the laundry. And one day I'm just going to let it go. And again, check myself and do what makes me happy, right? Another comment I have is I have found myself in spiral thinking about all I have to be grateful for, and yet feeling immense guilt for not caring about going on with life.
When you, that's another, again, that's another thing to look for. If you're not able to find a reason to be grateful for, that means you're not feeling so good, right? You need to reach out for help. Whatever is the easiest avenue for you, whether it's family, whether it's friends, or if you are comfortable going straight to professional help, please do, right? Guilt about anything and everything around me, feeling guilty about things that I may not even have control about, that's another thing to watch out for, because that is another symptom of depression that kicks in fairly quickly. So again, guilt, if you're feeling guilty about even for the things that you have no control over, you should reach out for help, whatever avenue you feel most comfortable with, but please do reach out to somebody.
Do you recommend any supplements, would you say, that may help with either sleeping for those that are going through, insomnia because of depression or whatever the case may be? Right. But are there any supplements, natural supplements, that anyone can take?
So there are St. John's wort, right? It's a common supplement that people use for blues, depression, sadness. The reason St. John's wort works is because it has the same serotonin that many of our medications do. If you decide to take it, I would definitely recommend at least having a conversation with your, primary care doctor or anybody, especially if you're on any other medications, because if there are, there are medications for medical reasons that do work on serotonin. So if you have an overload of serotonin, that can have side effects. But that does work for a lot of people. It works, and that's, I guess, one of the most common supplement that I can say even prescribed, right? The providers for people who don't want to take medications and want to go natural route. That's probably one of the most commonly suggested natural supplement. Again, St. John's wort is the one, but please do talk to somebody if you are on any other medications to make sure that it's safe for you to take.
Okay. Dr. Ansari, if you want to just drop the name in the chat, that would be
okay.
Great.
Sure, absolutely.
And then, is there any research or data on the long-term effects of this surge in mental health issues due to the pandemic? Long-term effects.
Is there any research or data on long-term effects of this surge? So from, sorry, I did it wrong. I'm sorry. Let me just pay attention to one thing at a time. This is the correct spelling. Melatonin absolutely works for a lot of people, helps with sleep, natural supplement. So definitely. In terms of research, I'm going to get to that. There have been research done within this pandemic itself. And again, because of all the isolation and stress and anxiety coming from it, and the loss that, so many people have died. I think at this point, almost across the world, there won't be one person who hasn't had some type of loss, either, family or extended family, neighbors, somehow or the other, we have all been impacted by the loss, just because the amount of people that have passed away from this. So there is definitely a surge, and there are recommendations, from professional organizations that we need to have proper avenues and more resources available to target the mental health, I guess, surge. I would use the same word to handle that, because it's coming. But also this is coming from the pandemics that have happened in the past, and the outcomes from that. There have been noticeable increase in terms of mental health resource acquisition. So definitely it's known from past pandemics, but even during this pandemic, now it's been a year out, definitely. And that's why we are having this webinar, things like this, to impress on people that it's not, that you're not in this alone. Everyone is experiencing this, everyone is going through this. And if you are having this, please reach out, please get help, because it is important. If we don't, it's going to be another mental health pandemic if we let it, if we don't try to control it beforehand.